distinguished panels, audience. My name is Chang-Chuan, professor from National Taiwan University College of Public Health. Today, I'm going to talk about healthy air for healthy school in Taiwan, a program that we are currently promoting. My talk will cover these 5 parts. I'll talk about current air pollution policies and measures adopted by schools in Taiwan. And second, I will talk about 2 monitoring stations. One is Air Quality Monitoring Network in Taiwan, which is established by Taiwan EPA. It's a regulatory monitoring. The other one is low-cost air sensors network in Taiwan, which is citizens initiate monitoring stations that be very useful. Later on, I will explain more about that. And I want to compare these two and to see how they can be used to protect children's health at schools. Lastly, I will conclude my talk and make some recommendations. We have a national air quality standards, just like many countries. You know, you have particles, you have gases such as SO2, NO2, and also have ozone and has some heavy metal like lead. And today, I'm going to focus on the most important air pollutants we are facing now in the world, which is PM 2.5. That means particulate meters with diameters less than 2.5 micrometers. And in Taiwan, we have 24 hours average values, which kind of daily average is 35 microgram per cubic meters. And we also have yearly average, that means annual average less than 15 microgram per cubic meters. And this is a kind of standards that many countries adopt, but this is still a little bit higher than WHO guideline, which is a little bit lower than this one. And school air quality protocol, we relied on warning and protections. You know, our Ministry of Education's MOE back in 2018 mandate that secondary schools and below, including high schools, junior high schools, elementary school, and kindergartens, are to monitor air qualities focused 3 days in advance. You know, daily we have a focus in the morning, 8 p.m., and at the noon time around 12:30. That's the time that the school will announce what kind of air quality, especially PM 2.5, is in the school. And schools are required to raise, we call it flags, pollution flags. It's colored each day for corresponding to this Taiwan Air Quality Index, AQI, to notify teachers, coaches, students, and others about outdoor air quality. Okay, so this is known as school flag programs. I think using this warning, and we try to protect vulnerable population at the schools, the children's. Okay. Schools are asked to know students with pre-existing conditions such as heart, lung diseases, and allergics. And these vulnerable populations are known to be prone to be affected by ozone, particulate matter, etc. Approaches to protect this, you know, should be planned and implemented, such as reduce outdoor physical educations, class time, and adjust exercise activities, etc. And in severe, even we can close down the school. So this kind of protocol we are designed to protect school children. And these are colored flags I just mentioned before, starting from green, yellow, orange to red and to purples. So it depends on the concentration of AQI, which is mainly driven by PM 2.5 in Taiwan. So look at this. If you have AQI above 101 and you starting have the orange, then we have some kind of restriction like short activities for recess and physical education, because those are many students spend outdoors. And for longer activities like athletics practices should be less, for intense and reduced activity for those people who are symptomatic students, like asthmatics. Children has to be asked to stay indoor, not to go outdoors. And if we go up to this, this rate, then you have to take more breaks, and even we have to reschedule some of activity to other dates. So this color flag together with some of activity change to reduce exposures. And this is school flag programs that's established by Ministry of Education. And basically is 6 steps, right? Focused and give out, raise a flag and give out this warning and to teachers and students as well, and planned activities and etc. So this is awareness program that tie with air monitoring. I think this is very suitable for educational environment. You just cannot mandate activity. You have to do this through the educational process. And not only this, every school has to document every day that the color of these flags they are raised. Then we can accumulate this as a historical document. Then we can use this for future use and for data analysis. In Taiwan, currently, we have 77 stations across Taiwan established by Taiwan EPA. We call air quality monitoring networks. 7 air quality zones were designed to manage air quality regionally, and spatial resolution is around 10 to 25 kilometers by these networks. And temporal resolution, we report hourly concentrations, and on average, the height of monitoring is around 10 meters. Okay, and right now, 50 stations are located in schools. And out of these 77 stations, and a total of this populations of students in this school is around 80,000. For the airbox, it's different from Taiwan EPA's air quality monitoring stations. Airbox was initiated by citizen science to provide the real-time PM 2.5 concentration, thus enable and encourage participatory air pollution monitoring. Item measures in this airbox are PM 2.5 and temperatures and relative humidities. And methods of detection of airbox is light scattering, and locations are mostly semi-shaded corridor locations at about 2 or 3 floors. It's around like 3 to 5 meters high. Okay. This low-cost airbox in Taiwan, start from 2016 March, then it grow step by step, and later on they connect with so-called Internet of Things, IoT concept, and to become a database that very useful, and they have very high spatial and temporal resolutions. Until today, there's over 1,000 being put in schools of Taiwan. So that's very useful. As you can see from this map, this is 1 day's data. We have a snapshot of this one. And you can see from this Taiwan map, the green one corresponding to the concentration. You can see from these colors, and green to yellow to orange. You can see there's a regional difference. In the north, air quality is much better. In the south, air quality is worse. And there's also over 24 hours, and you can see the trend. And for PM 2.5, for temperature and humidities. And the pictures show you where they are put. The white one on the far left is where they are put. Children between 3 and 14 years old, spend most of the time indoors, both in winters and summers, and in schools in Taiwan, because ours are subtropical. Our indoor environment is more like outdoor because we open our window mostly, So that's the case for Taiwan. Even the winter time, our temperature never get too cold, seldom in single digit. So windows are open mostly, so the ventilation is good. So indoor is more like outdoor. But in other parts of the world, people have seen that indoor-outdoor ratios of PM 2.5 will be different, more indoor than outdoors. For like in India, for some cases, if you have filtration, it could be indoor lower than outdoors. But we don't have the data now in Taiwan, so we assume indoor is the same as outdoors. Okay. And this is policy influence both of indoor and outdoor in the future in Taiwan, because our government will start put air conditioning in every classrooms in the coming years. So in the future, the indoor-outdoors ratio could be changed. And people has been debating about this. If our power for these air conditioners are from coal power plant, then probably we will deteriorate outdoor air qualities of our school in the future. So we'll see. And now I give you some number of juniors and elementary schools and number of air boxes we have. So in the tables, you can see we have all these counties in Taiwan. Those are in red. We currently have no air box monitoring. Those are in black, talking about how many schools and air box we have, and the distribution are in the Taiwan map. And it's quite widely available, but not completely monitored yet. However, this is a great improvement from the 77 monitoring stations we have for the Taiwan EPA's monitoring network. So if you compare the population of students and the airbox monitoring deployment, and you can see there's 4 areas that are lacking now. So we said just Taoyuan, Taichung, Changhua, and Tainan cities are 4 most needed places to install airbox. So I will give you 1 month's data back in 2019, December's. We will show you how airbox can improve the protection of children's health from PM 2.5 exposures. So I use airbox data in 7 counties and cities, and where airbox are deployment, and 24-hour monthly annual mean concentration are calculated, and a number of airboxes on this 7 years are shown, and we also use the 7 air quality monitoring stations that in this city, these places to compare, and as I told you, Taiwan used the AQI calculation as a formula listed here. We use this one to do the focus and to warn the students. So this is PM 2.5 concentration from airbox in 17 counties and cities. And the green bars are number of airbox days that's above 35.5 microgram per cubic minute. That would be orange in our case. As you can see, that's a wide difference from over 5,000 to less than like 100 in different areas. So you can see students' exposure to 2.5 are very different. However, if you look at long-term exposures, like a monthly average, even the low concentration area, like a Taipei City, still there's a monthly concentration in some schools are very high. So that can be reached as high as 35. So this kind of monitoring actually gives us a lot of information. And if you look at this difference, the upper one is air quality monitoring stations, predictions. The lower one is airbox. And you hardly see any orange in the upper one. And you see mostly yellow and orange in the lower one. So this tells us, by using air quality monitoring station data alone, you actually underreported the actual exposures students are exposed to. On the other hand, by using airbox, actually you can catch more actual air pollutions in the school students spend really their time. Because for the upper one, we use the nearby air stations, air quality monitoring station to predict the schools, which could be 20 kilometers away from the monitoring station. And the airbox is actually right this time and the place those students are spent. So that's the reasons I think that can provide better protections. And especially for those orange one, you know, you have to start implementing some activity restrictions policy, right? So in conclusions, airbox, you know, air quality monitor station reflects microenvironments, you know, which are better to detect localized air pollution emissions. Think about this graph. You can see why airbox can catch more divert air quality data among the schools, because each schools is affected by specific local emissions, such as traffic. You know, the traffic emission would vary very much, even within a single city. So this shows us we can identify localized pollution source, and which cannot be observed by air quality monitoring stations. Then this information can help us identify unexpected local emission source, also reflect children's exposures to PM 2.5 with refined spatial and temporal resolutions, which key to protect children's health. And current government established AQMS are not enough to protect children's health through my research. By contrast, citizen participatory air quality monitoring using airbox in Taiwan can better protect children's health at schools. So with this, we kind of entering a new era of air monitoring. We can not rely on government to do the air monitoring, which is useful for law enforcement. But in terms of exposure reduction or health protections, I think citizens participants is very important, and airbox use in Taiwan serve as an example which can be used in the future in other places. So my recommendations through my research is, first, I want airbox deployed to all schools. You know, we still have at least 40% more of schools to go. We have to put them there. Next, we should use comprehensive health surveillance systems to track. You know, we never know that there's some proportion of students who are suffering health outcomes even in the green zones of our air quality index, because as we know, PM2.5 could be no threshold. So this is very important to do some health surveillance systems, which we have not started, and we are planning to do that now. And air boxes should be installed in the classroom in the future, because as we are going to install air conditionings in all the schools, and we are worried about that. Will this kind of air conditioning increase or decrease PM2.5 concentrations in the school students spend actually most of the time there. So the change of physical settings of classroom will affect students' exposures. So this is a recommendation I have made to our government to do in the futures. Thank you for your time, and thank you very much, and wish you have a happy time and stay safe in this ongoing COVID-19 pandemic. Thank you. Bye-bye.